And Paul, we will get to your question, I'm sure, before the morning's over, right? And I want to thank you. You were extraordinary, Marcia. Thank you so much for your hard work. If you recall yesterday when we started setting the stage, we had one of our very valued colleague wasn't able to join us at that point because of all of us have issues trying to get anywhere with our day job. Well, today we're lucky because we have her in the room. And before we get to the closing session, I'd like to first of all introduce to you Flora Castillo, and then ask her to speak with you. We talked about how do we get to the intersection of transportation and healthcare. Well, Flora has actually been living at the intersection of transportation and healthcare. Matter of fact, if you can recall the image that, for some of you who might be as old as I am, there used to be, before we had traffic signals, we used to have these boxes where the constables used to stand up on the boxes and kind of direct the traffic. Flora, in many ways, has been doing that, both through her day job and as well as her volunteer work. Flora Castillo is the Vice President of Community and Strategic Engagement at United Healthcare. And as importantly, she has been the chair of the American Public Transportation Association through her work as a volunteer with the New Jersey transit folks. And she's been just a very strong advocate of being able to marry these two topics. And today I'd like to ask Flora Castillo, please, ladies and gentlemen, help me welcome her to us to make some remarks. Thank you. Bienvenida.
Good afternoon, everyone. It's a pleasure of joining you here this afternoon. Sorry I could not be here yesterday. As Ysela mentioned, I've sort of been living in the world of transportation and healthcare now for a little bit over 16 years. By way of background, I am a board member at New Jersey Transit, and what allows me to do that as a volunteer on a volunteer basis is my day job. And so for the last 25 plus years, I've been in healthcare, primarily focused on Medicaid managed care. And about 7 years or so ago, in the process of doing my day job, visiting a state of, where Valerie is from, Nebraska, a light bulb went up on my head as I was having conversations with different stakeholders. At that time was a Diabetes Association. And my question to her was, what is the number one barrier that you have that a managed care company can solve? And, unbeknownst to me, it was transportation. Many of our diabetic members cannot come or cannot attend their education sessions or visit sometimes their primary care providers because the, rural nature of some of the areas and the need for, more frequent and capacity issues. And so fast forward, I had the great opportunity in 2012 when I was elected chair of the American Public Transportation Association to elevate this conversation and create a bridge between the public transportation industry and the healthcare industry around, we do have a role that we can play. We can be the bridge to increasing the access to critical health services. And to many of the comments earlier, when I had conversations within the healthcare industry and some of the leaders of the trade groups related to whether it was managed care or other healthcare providers, this issue of transportation did not register. And when I talked to the folks in the transit system, the CEOs, and I said, how are you partnering with healthcare systems? That issue did not register. And so to your point about earlier, and I would wholeheartedly support the need for developing common language, the need for ensuring that we're doing that cross-pollination, because even as in my new role at United, as you introduced me today, I'm a new member of United. I've only been there for about a year. And consistently, you can see where there is that great opportunity to cross-educate ourselves to what is that mutual language. At the end of the day, we all want to make sure that our members get consumer-centric care, as we say it, or member-centric care. And at the center of that is essentially addressing what is keeping them from accessing those health services. Right now, I am focusing at United. I'm part of an initiative called My Connections, and My Connections is a unique, holistic initiative that seeks to integrate and aggregate government services as well as social services, all with the end goal of ensuring that individuals get their barriers eliminated, whether they want to access housing, whether they want to have access to their work, financial services, or food. And so in that role, I lead the vertical that is looking at creating innovative partnerships within the transportation sector to ensure that we addressing those needs. And so again, I would also encourage from just listening in the background that the healthcare sector, managed care industries are interested in partnerships. Transportation is not our subject matter expertise. Healthcare is. Taking care of members, delivering the right clinical intervention at the right time is what we do. And so we have a great opportunity to support what you said earlier. Roy, I think is your name, with a great opportunity. The other thing too, talking about an initiative that United just recently created. We recently unveiled a white paper that was to Kathy Walker from the National Core Indicators, who was on the earlier panel. We rolled out a white paper that developed a quality framework that seeks to measure the quality of services and support delivered in a managed long-term services and support environment. And we did that because we know that out there isn't a consistent framework for measuring quality. And I'm pleased to say that this is something that United has taken the lead to push those metrics out, to push that framework so that we can be held accountable. And so within those measures, we have taken several questions on transportation, which I'm pleased to report to you. And we'll be unveiling another initiative that will be specifically around the intellectual disability and then developmental disability communities in terms of what that framework should be. I am pleased in wrapping up, I want to say that I am delighted that we find ourselves here having this conversation between the value of transportation, what it does, what it can do for individuals, and more specifically in addressing those barriers. There's a lot of work to be done. We're through My Connections, we're trying to test what it actually, whether or not offering transportation does increase the participation of individuals and consumers in accessing simple things as food if you're diabetic. And so we are interested in doing more pilots. So many of you, afterwards, if there's any innovative area that you think that we should be aware, that's something that we are entertaining, all with the end goals of testing and developing those pilots to see what actually works. At the end of the day, we want to make sure that our members have the right set of access at the right place to get the right service that they deserve. And from a personal and passion perspective, I know there is a value for ensuring that transportation is that enabler, whether it's housing, jobs, financial services, or other conditions. As we discussed earlier this morning, medical care, we are that enabler that provides that access. And so thank you for the opportunity to address you today. And by all accounts, you've had a tremendous, successful 2 days, and I thank you again for the opportunity.
Thank you so much, Flora. I really appreciate those words, and more importantly, appreciate your commitment, because I know that you can influence the industry, both industries. So, and if you recall, folks, yesterday there was a comment about, well, are we sure that the insurance companies and others are also engaged in this dialogue? So we wanted to make sure that it was clear that they were. Okay, so here we are on our very last session. Let's give ourselves a hand, because I think we have been extraordinary at sharing information. Vincent, you ready? I think we need to hear from our sponsor, folks. This would not have been possible if it had not been because the Federal Transit Administration sponsored this workshop, and I think Vincent and the FTA deserve a hand. Or two hands.
Thank you, Ysela. Thanks very much. And wow, what a day and a half. This has been a remarkable journey just in the few hours we've spent together. But before I get started, I want to thank the National Academies for hosting this. This has been a magnificent time and a wonderful venue. I want to particularly call out Steve and Alina. I don't know if you're here, but I'd like to, maybe you could wave, and I'd like a hand for it. But I'd also like a hand for Ysela, who's been an absolute MC. I mean, you've been a star, so thank you so much. And in fact, yesterday, Ysela started off by comparing this to a wedding, and I think really it's been not so much a wedding as it's been a wedding reception, if you will. And I don't mean like we're going to dance YMCA or we're going to get cake smushed in our face or anything, but that this has really been kind of the, I think, establishment, or really actually the celebration of a relationship that we knew already existed, right? There's always been a connection between transportation and healthcare, and I think we needed this event in order to institutionalize it, in order to really kind of bring it out and show the world that we're talking. What strikes me really about this is that this conversation needs to continue. I think first and most important is that we need to establish a number of basic values. And I've heard it yesterday and today. I think we're already there. I think in establishing those basic values of perhaps being person-centric, being traveler-centric in the parlance of my side of the house, the transportation, or being patient-centric in the healthcare side, it's important that we think about this as being an endeavor for people, that we're providing better healthcare, we're providing better transportation, and that we're providing all the aspects that make for just a better quality of life, which I think is also an important kind of shared value that we have. I think there are a number of things that we need to do to go out from here. I don't want this to be the beginning and the end of a conversation. Like a wedding reception, it should be the celebration of a continued relationship through the years. And I would definitely like to see a number of next steps in terms of how we take this into the future. First of all, I think, again, that we establish that that value system, that idea that we're making people's lives better. That's super important. I think the other thing that we really need to do, and Flora mentioned it, a number of people here have mentioned it, I think Roy mentioned it as well, and by the way, I'm from New York too, from the Bronx, so transit's in my blood. I think it's important that we really develop a common language. I know that just the last day and a half have been revelatory for me in terms of the different way we speak about who we serve. And so it's important that we have, I guess you could call it a Rosetta Stone, if you will. And so I think that would be a task that we need to do from here on out. And how we do that, I think the devil's in the details, and I think we're going to have to figure that out, but it's very important that we do that. they've always said, and I'm an engineer by training, that you don't value what you don't measure, right? And so we really need to think about common metrics, if you will. And I don't like using the word metric so much because it's so mechanical. It's so disconnected from humanity. I think what we need to do is measure those factors, those things in people's lives that make for a better living. And if it's quality of life, quality of health care, overall, I think it's important that we start measuring the same things that we can commonly agree on, that we can then say, hey, look, we're succeeding here. We're providing for better service, we're providing for better quality of life for people, and the people who we're serving are satisfied. So that's important, that common Rosetta Stone on that too. I think it's important from our perspective, and again, I mentioned earlier that we have a couple of programs at FTA. One of them is the Rides to Wellness program that Marianne spoke about earlier, and that Bruce Robinson, who is an Deputy Associate Administrator for Programs, spoke about yesterday. But that it really, that and my Mobility on Demand program, which we mentioned earlier when I was at the microphone before, that we continue to pilot new and exciting ways of providing service, that we pilot these opportunities for different partnerships and different models of providing transportation service for different sectors and different client bases. The Rides to Wellness is very much based on kind of the lexicon that you're all, I think, comfortable with. MOD, or Mobility on Demand, is much broader. I like to think of it as rides to life, right? If you think about it, a ride should be a ride, whether it's a ride to recreation, it's a ride to healthcare, it's a ride to your economic generator, if it's your job. Whatever it is, we need transportation. Think of transportation as being something like it's a commodity, it's a utility, it's a social service, it's all of those things, all wrapped in one package. And my hat is off to the general managers and the people who work in transit to deliver service every day. And so what I'm trying to do through the Mobility on Demand program, we've put $8 million on the street, as I mentioned earlier, and we're really looking for best practices, for pilots out there that are going to demonstrate the best way of providing a service to that individual. Again, a very traveler-centric, user-centric, user-focused approach. Our technique, or our approach in our research program, and mind you, by federal standards, we're a very small program, $20 million a year, is to try to show best practices, to try to show pilots and demonstrations. And that's one of the things that we really do need to continue. I think it's important from here on out, and particularly after I've been immersed in this last day and a half, that those pilots, those demonstrations, reflect the healthcare community as well. And so, as I mentioned earlier, I'm really interested in seeing how we take mobility on demand into the future and how we may focus it on different aspects of service for people who need it, whether it's getting to a job or getting to healthcare, both of which are, I would dare say, equally important in a person's quality of life. So again, continuing those relationships, and perhaps even reaching out across the federal space, which is not as easy as you might think, but making sure that I'm talking to people at HHS, and I'm talking to people at Commerce, and I'm talking to people at Department of Labor, and all of these places that frankly have deeper pockets than I do, but that can also help bring that perspective of that user base to what we do in public transportation. So that's also an important aspect of, I think, what we need to continue to do. Really, I think, kind of to wrap up here, I'm very excited that we've been able to have this event. I hope it's not the last. I expect to make friends. Again, as a wedding reception, I hope I will keep in contact with the friends I've made and the contacts I've made. I think we need to continue the dialogue, and I'm looking forward to working with all of you in the near future. Thank you very much. Okay.
I'm going to ask him to stay, right? Because I'm sure that there are comments and suggestions on what we need to do.
Or questions?
And questions on going forward. But, Alina?
From the web, but I could wait.
From the web. Okay, from the web. Let's go and see.
Sure.
Okay, so this is from Suzanne O'Neill, who is a consultant in the Rocky Mountain West. And she's talking about data issues, and she's saying that one key challenge is that the burden of funding transit, including demand response, it's in the state, federal agencies, the bottom line is, oh, that sentence doesn't make sense. Sorry, let me skip ahead to, she had a few points.
Okay.
She said, it's important to focus on data that could work for us. She said the information yesterday on showing medical centers the lost revenues due to lack of transportation was useful. Measuring how transportation is able to keep people living independently is critical, keeps the quality of life higher. This could start with the AA participant assessments and needs to include cost-benefit over several systems. Pick less than half a dozen items to measure and do them well, which I think everyone would agree with. We need to better match costs and benefits. We won't be able to increase resources for transportation if we're asking locals to pay for the costs, while benefits are occurring at the state or federal level or to the for-profit dialysis center. I think that's the point she was making earlier, but it's very clear here. We need at the federal level to have the ability to make the best decisions for resources and mobility. The current system where the program is trying to shift costs to others is not sustainable. Lots of work is needed here. I hope the CCAM is able to tackle meatier questions this time around. And finally, I agree with Roy Grant's suggestion to get uniform definitions. And then one other brief question is from Charlotte Fry, who is a transportation planner in Chicago. And she says, I wonder why the FTA is always represented at these events, but FHWA is not. Why does it fall to transit to meet mobility needs, while FHWA focuses on moving vehicles? In other words, why is the connection to healthcare directed to the FDA? Isn't it a larger objective for all of US DOT?
I think I'll leave that one to you.
Thanks
Vince.
a lot. Thanks a lot. Yeah. Where to begin? Where to begin? I'll start on the FHWA question. I am a firm and card-carrying member of the Federal Transit Administration, and because of my background and ethos, I am very much committed to public transportation. That said, the people at Federal Highways are as equally committed to mobility as anybody in this room. And I have to say, they are showing up at all of the events. I happen to be here today, but my partners in the Federal Highway Administration right now are funding, for example, a program to the tune of, I believe, $125 million per year, which is, by my lights, a staggering amount. Certainly, as I mentioned, we're much poorer as an agency than Federal Highways. And it's called ATRI, or Accessible Transportation Technology Research Initiative. And the whole point of that initiative is to facilitate mobility for people with disabilities. Just the other day, and it's about technology, but it's also about practices. Just the other day, they demonstrated a technology at the HQ, at the DOT HQ, which helped a blind person navigate 2 buildings. I mean, literally, she was wearing a headset that gave her directional instructions on how to get from one end to the building, unassisted, from one end of the building to the other, and then up to the 8th floor. And then she went to the edge of a large portico that we had there. Remarkable. It succeeded, and that's funded by Federal Highways. And the important thing to keep in mind is that why is that an important technology? Well, the intent of it is to help people navigate subway stations. So it's, again, this demonstration of cross-modal, of multimodal approaches to mobility. I think we're all tumbling to the idea at HQ, at DOT, that it is one DOT. It's a multimodal approach to transportation. Just as in some contexts, transit is the way to go. In others, it's pedestrianization. In others, it's a bicycle. In others, it's a car. And so we're moving towards a kind of uniform mobility that actually gets back to the idea that you're being traveler or transport or person-centric. That in one context, the best approach is to use transit, and on another day, the best approach is perhaps to use an Uber ride or Lyft or a bridge microtransit ride. That you are selecting your best solution, knowing your conditions on the ground in real time, and you make your choice, and that it's instantaneous, that you get service when you need it. I'm here to say that I think the technologies are available. I don't think that there's any question that we have certainly the data capability right now in terms of collecting data and processing data, the communications capabilities. I mean, everybody or many people are carrying a smartphone, and I think the barrier to having everyone carry some sort of smart device that is more empowering than anything else is close at hand. So I think the technological obstacles are fairly straightforward to overcome. The difficult things are going to be the institutional ones, the ones that are perhaps even internally in federal space, the regulatory ones. I mean, I work for the federal government, folks, and there are the 3 R's: rules, requirements, and regulations, right? And each of our federal agencies is vested in those rules, requirements, and regulations. One of the aspects of our Mobility on Demand sandbox and why we put the money out on the street to demonstrate creative approaches to providing mobility is that we wanted to provide a space where we might relax some of those requirements and those rules. We may not be able to do the regulations because, folks, that's law, and law is law, and unless you change it at Congress, it has to be observed, and as it should be. But that we're empowering transit agencies to work with different partners to provide just a better service. Why is it that some people can call an Uber ride or whatever, or a TNC ride, and it's waiting for you 2 minutes from now outside of the door, and other people who may be using different approaches or maybe even trying to get paratransit can't do the same thing? I would dare say it's not the technology. I would dare say it's the rules and requirements and regulations, and we need to think about creative ways of perhaps being more proactive about what those rules, requirements, and regulations look like. I always use the joke, it's an old kind of thing that I've used in other discussions and other speeches, really, that when the automobile first came out in like the late 1890s, in many localities, and I know this to be true of New England and parts of New York, that if you drove a car, you actually had to have a flagman walking in front of the car at 5 miles an hour in order to warn pedestrians and people on horses that a car was coming. Imagine if we still had that rule on the books. Would any of us be driving? Probably not. So we need to look at these requirements and these rules, again, proactively. We need to look at them innovatively and say, okay, which makes sense to protect the federal interest and the federal dollar, and which don't make sense anymore. And so that's part of what I think I'm seeing more of at USDOT. Any other questions?
All right, I know we have some more, and more importantly, if there are any suggestions. David, you had a good point that we needed to deal with both short-term types of observations. Remember, we don't make recommendations. Observations, and then some long-term observations. And we've heard a lot about different ones. Some of them you've picked up on, Vincent, and I want to thank you in particular. I mean, the FTA has been here for the entire day and a half, and I know how hard it is to do that. And matter of fact, we've had their presence from the very top of the organization. And I think that's to be commended because it shows their commitment to this. But we also know that your money is catalyst money. Mm-hmm. It has to, like I said, like the pizza dough has to grow, right? It has to grow, which means others that represent other interests in this room need to continue to grow that money. But I want to hear from some of you on some observations that you might have at this juncture. So, I know we don't have shy people. I've heard you.
So one of the observations that I've seen over and over again is we need a study, we need research, and there actually is $377 million in research that's being funded through the University Transportation Center program, which is basically out of the Office of Assistant Secretary for Research and Technology. They used to be OSTR. They have money and are looking for research opportunities. One of the key goals of that money and of that research over the next 5 years is to improve the mobility of people and goods. So go to utc.dot.gov, bookmark that. They're going to be announcing the centers. There's national centers, regional centers, and tier 1 centers, which are kind of themed or topic centers. But it's just amazing. The research is out there, and they often have trouble at these academic institutions of finding folks in the private sector and the public sector who come to them. Most of the time, they're kind of trying to, kind of flirt and wink at you, and you're like, hey, you want to do research? Well, when you come to them, that's a much quicker and less painful process. So I would just, being a former UTC administrator for 10 years, I would strongly encourage you, utc.dot.gov, the research dollars are there, and they're going to be looking for things to study. Boom.
Boom.
And they're going to be looking for partners to help, fund the research. So if you have some good ideas about types of research that they could do, I hope that you also have some good ideas about funding partners that would help them meet the matches.
That reminds me, and we were talking about it earlier as well. The other venue to keep in mind is the cooperative research program through TRB. In fact, we've got a transit cooperative research program soliciting ideas from all quarters, and the same goes for the highways cooperative agreement programs. I think these suggestions, any observations or any research needs that you might identify could be channeled through any of those cooperative programs.
You said only for people that weren't shy, so I guess I'm one of those.
So
that
Martin,
not shy.
I know you're not shy.
I'm not shy, ni vergüenza tengo. But there were two observations I'd like to make. The first one, I think if there is some type of formalized assessment of all the current federal agencies, would be invaluable, even beyond those that we would traditionally think. Again, I want to give a strong shout out for the Corporational and National Community Service, Social Innovation Fund. I mean, we approach transit concepts to them that they're like, what are you talking about? But you know what? We did the education and we're able to purchase units to provide this demand response dedicated service that it's being studied to look at the health outcomes. So I think there's more happening in the federal government that we may even know, that a formalized assessment, if it could be done, would be good. The second observation I would look at is as a 5311 provider, oftentimes NOFAs come out and we think of, oh my gosh, more work. I would say that perhaps an observation may be that one of the NOFAs be, let us send out a team to work with you so that you can systematize what you're currently doing. What of that can be a best practice that can be replicated? Instead of trying to capture in a formal way some of the innovative stuff that's happening in localized communities, especially in rural communities, 5311s. They're doing more stuff than we may even know about. And if we provide the support, they'd be better positioned to create those learning models.
That's a very interesting. Go ahead.
I can't let that pass. The Federal Transit Administration has 3 technical assistance centers available to help you. One is the National RTAP, and Robin Phillips is here, for specifically to collect and disseminate and aid best practices for rural transportation. We also have the NADTC, National Association, help me out. National Aging and Disability Transportation Center, that is for the purpose of doing the same thing essentially with regard to Section 5310 recipients and to help people providing services for people who are aging and or disabled. And then we have the National Center, the NCMM, National Center for Mobility Management, that aids and provides technical assistance with regard to mobility management for all sectors of the transportation industry. So just to let you know that those resources are available.
And I do want to give a shout out to 3 technical assistance and training centers. My comment was not in relation to what they provide.
Oh, understood.
Very familiar. My comment was much more about the importance of saying we want to be one of the pilot sites where a technical team would enter our facility and work with us for 2-3 weeks, a month's time, look what we have, what's strong, what works well, and come out with an actual service delivery model that can be then replicated and become a resource to the various centers. So I just want to make that clear that it was a little different of an approach that I was suggesting.
And perhaps then that very same type of assessments could be documented in guidebooks and other documents
Exactly.
that would help other people with the learning curve, correct? I mean, we don't all want to
Exactly.
be creating the wheel each and every time. We want to be
Exactly.
learning from each other.
That's right.
Okay.
Thank you.
Excellent.
So I'll be very quick. This is the National Academies, and I think it would be a huge missed opportunity if coming out of this we didn't come up with a research proposal that spans both the transportation sector and the health sector. Can I volunteer Alina and Steve to maybe take a quick, a first crack at that and maybe circulate it back to the group and see whether this could be submitted to TCRP and whether it could be combined with one of the health side of NAS, and maybe we have multiple proposals. There's been a lot of good research ideas presented here, and maybe we reach out to the university transportation centers, et cetera, and see where we could get some funding for these things.
Both on short-term as well as longer terms type of activities.
Absolutely.
Good observation.
Yeah.
Others?
Hi. First of all, I wanted to thank you all for this conference. And so I'm obviously from the healthcare world, and I have our project officer here from HRSA. So we've been chatting and talking about just how impressed we are, first of all, with the work that you all are doing that's already done. One thing I've learned that I guess it's a next step in there is just how much has been done and is currently being done, but that a lot of folks on the healthcare side are not aware of. And so I think there's a next step in there. I was also talking with some folks from the hospital world, Kaiser, and so we were there were so many things that we could apply, but I think, so the next step is sort of a little bit of the awareness. Ideally, I think an event like this where there's maybe more folks from that just to convene us would be, I think, incredibly helpful. I think two next steps, and I'm happy to volunteer if anybody else. I think one is documenting partnerships, current partnerships that exist right now. I think just capturing who these folks are, who are the transportation side, research side, healthcare side, and I'm happy to take an initial stab at it. And then who are some immediate next partners from sectors, the foundation world. There's a lot, so I'm happy to do that. So, and then the third thing that struck me in all of this is it's just such powerful information that I think could go the next step is obviously being from the healthcare side. What we're really focused on is population health, about people, social determinants of health, population health. That's next. That's now in healthcare. That's next. So I think information about who are the people, what's the data beyond some of the data that I saw here would be incredibly helpful, and I think would connect a lot of dots for those of us on the healthcare side, is because it's there, and I was kind of getting it, but I think if there's a little bit harder data on just who those are, and I think healthcare folks can certainly help with that a little bit. I think there's some data there, but where are some of those connections? So I wanted to share that, and thank you all for having us, and just congratulations on the work we do. And I'm just so happy to sort of learn more about this.
Oscar, I think I heard something that's really music to my ear. I heard not only some really good observations, but I heard volunteerism in trying to pull some of these observations together. Shout out for Oscar. I think he deserves a hand.
I'm really happy to do it. So is my staff. I mean, we're really passionate about this issue, and it's not going to happen unless we step up. And so I'm happy to do it. I'm not happy to do it.
I'm willing to do it.
I'm willing to do it, and I have the great job of speaking for the great work my staff does. So I should kind of butt myself because it's more work for them. But yes, we're willing to do.
We'll look forward.
Willing to do some of that.
We'll look forward to it. Very much so. And I asked you to do one last thing for me, Oscar. You said that you were from the health side, but remember when we walked into this room, I said, I don't want people being from the bride's side or the groom's side. At the end of this, we need to be on the people's side. So you are now, I'm anointing you also from the transportation side. Yes, sir, you got a dual citizenship. Okay. Sir.
Just a quick suggestion. We heard a suggestion for a research project. Of course, that deadline is fast upon us, but I'm thinking even before then, if you had two venues. One is you have a planning committee which can refine the objectives of a common data set. And then with some, not me, but some of the real experts in data that we've had speak here, in a round table do a data mapping project to draw the links, because our terminology is so different, to draw the links of commonality and and where they're not common, how we can get on a common basis to get to those common objectives, for which I think you spoke earlier about having, you can almost picture it, a picture of a person in the situation and then the data written across the picture, as we've seen in some of the slides, of the numbers involved in transporting people with Alzheimer's to adult daycare, or kids with asthma to pediatric treatments, and to draw that out.
And I think that we also talked about that there are some surveys out there that are seeking information on how they ought to be modified. So we're at a very good opportunity to be able to influence some of those, and I would hope that that would be one of our observations as well.
Yes, I'm going to add one more in the weeds, and that is non-disclosure agreements and what are the ways that the HIPAA data can be accessed. There are people with expertise that have actually gone through that, and one thing that can blow your project is to stumble on that. So guidebooks and examples, and even a wiki on the website that says, if you're thinking about approaching this partner, here's the kind of documents you'll need. Maybe you'll need to have IRB, and just give some little scenarios so everybody gets up the learning curve a little bit farther than they would if they hadn't come to the conference.
I think that's a very good point. Yeah, a clearinghouse of sorts. I mean,
Yes.
even for me yesterday, I couldn't spell HIPAA, right? So. Okay.
Or supercalifragilistic, right? But how about others? Other thoughts, please. Alina, do you have some that you picked up on that might not have been stated already that you'd like to share with the group?
Sorry, I'm not going to share any sort of summarizing thoughts, but I did want to make it clear for everyone who's participating that the proceedings will be written up and they will be published as a workshop summary. We have an independent rapporteur who will be working from the video, which we're going to be posting. It's going to be archived permanently, and all the slide sets, and we're having this prepared as a transcript. So there will be a wonderfully written workshop that will have, I think it's going to need lots of tables of resources and so on, because so much good stuff has come out of this. So I wanted to make sure that everyone is clear that everything you've heard, this isn't going to be gone. And those of you who are on the web as well, that you're going to have access to the learnings from today. And of course, I hope that the conversation can continue, and so we're having some sort of backstage whispers about what sorts of learning communities might be supported as a result of this. So the timing is going to be about 3 months from now. So when that is released to the public, we will be sure to send you all the link. It's going to be available as a freely downloadable PDF or as a slender book that you could purchase from the National Academies Press. Yeah, and all the presentations are going to be available on the same web page as where the webcast was available. And if you didn't sign in when you came in, please make sure we have your name and email address so that you could get that information. The presentations will be available in just the next couple of days if we have a permission form from everyone. So if you didn't fill out a permission form, please see me.
And I would hope that when you get that link from Alina with all the materials from this workshop, that you would go and disseminate it to your 10 best friends, right? Because that's part of our responsibility as participants in this in this marriage. Okay. Anything else for the good of the order? Yes, sir.
I think what was, to me, particularly gratifying was the almost universal, let's call it universal, commitment to people, and that there's a moral imperative to do what we're about doing.
That's correct.
I usually don't do this, Ysela, but I'm going to do a commercial on 2 things. The first thing is there's a competition call that TRB has been doing. It's its 10th annual. And we're sort of proud about it this year because I've been involved in the group trying to put it together. And Nicole seeks best practices in communicating the connection between transportation and public health to John and Jane Q. Public, the average citizen on the street. And this whole competition came about with transportation planners trying to get their complex concepts out to the public so the public understands them. And this year they focused on health. So I'm going to put some of these out at the registration table. And there's a website and you can learn a lot more about it. The cool thing about it is it's stuff that people have already done. And I heard from some of these programs where you're reaching out to your customers, you already did your marketing program, and I think that a lot that would play well with this. And the other commercial I'm going to do is real quick. It's a URL to my Health and Transportation Subcommittee, and it's a little broader. We don't focus on access to services. We're focusing on the much broader health issues and transportation, and it's real easy. It's trbhealth.org, and we've got a listserv, and I think it's a nice forum where we could kind of pull people together, and we do have health folks there and transportation folks. And actually, there's a whole group of people out there that are now getting dual degrees. They're getting these things called MPHs and planning degrees.
Yeah. I love dual degrees. Thank you, Ed. That was Ed Christopher.